Welcome to a preview of the manual small incision cataract surgery simulation. This simulation is currently a work in progress, and this preview will focus on a small part of the surgical procedure, the anterior capsulotomy. The simulation always takes place under the view of a microscope, but if we view the scene as a whole, as shown here, we can see the full setup of the patient resting on the surgical bed, with the eye held firmly open by the lid speculum. Now we can go to the view the surgeon will take while operating, which is under the microscope, as seen here. The eye in this simulation is built to replicate the human eye anatomically, visually, and physically, so it behaves exactly as it does in the real world. For demonstration purposes, we can use the grab tool to drag the eye around in the socket. This shows the slight inertia and weight of the eye as it moves, and resting in place when it's let go. On the right-hand side of the screen, we have a selection of tools available. All of the key tools and processes the surgeon must carry out in the procedure will be organized here. We can see here how clicking on a button will bring the tool into focus, allowing the user to start the task. To adjust the microscope, we can bring up the camera window to show the options that are available. Adjusting the zoom slider will change the magnification of the microscope. With the autofocus box checked, the microscope will dynamically find the correct level of focus for the magnification, mimicking the parfocal lens of microscopes used by cataract surgeons. Additionally, the focus slider can be adjusted manually if we choose. Now, let's bring up the patient customization window to see the various capabilities of this simulation. The window shows a wide range of different options that can be fine-tuned or even changed completely. This allows the user to experience a different challenge every time they use the simulator. In the real world, no patient is the same, and this simulation allows for that wide amount of variation. The first option is the eye hydration level. We can see how using the slider causes the sclera to become less smooth, and the cornea reflections to become less sharp, while decreasing the moisture of the eye. We can also customize the color of the iris on the patient, with options for both inner and outer detail, which can be set to any desired color. To demonstrate, we can change the red, green, and blue sliders in this window to change our patient's eye color from brown to blue. Next, we can try out the dilation slider. Moving the slider causes the eye to dilate in a smooth motion. There are also options for the cornea. We can check the distort box to toggle the slight magnification effect that the cornea produces. We can also intensify the reflections and the cloudiness of the cornea if we choose to do so. For options a bit more directly relevant to the surgery, we can modify the intensity of the red reflex, as well as changing the nucleus density to simulate the different severities of cataract, allowing the user to work under different conditions with each procedure. We even have control over details such as the tone and amount of veins visible on the eye. And also the skin tone of the patient, with even subtle details such as the sclera color changing with racial variation, once again helping the learner by presenting them with a unique patient every time the simulation is used. One thing a surgeon must be aware of during surgery is the hydration of the eye. By using the patient customization window, we can dehydrate the eye for demonstration purposes, as seen here. Now that the eye is showing signs of dehydration, the surgeon can request fluid to be applied to the eye by clicking on the relevant button on the right-hand menu. As seen here, the flow of fluid over the eye returns the sclera and cornea to their hydrated state. The viscoelastic injection into the eye is simulated by selecting the relevant option from the right. As this preview of the simulation is only replicating a sub-step of the surgery, which is the anterior capsulotomy procedure, the scleral groove incision has already been made for us. The cystome is inserted into the eye through the incision point and is slowly withdrawn while releasing the viscoelastic. As the viscoelastic is injected, we can see the pupil fully dilate, and fluid escapes from the anterior chamber out of the incision. The cutting of the capsular bag is one of the important stages in the surgery. When the eye is fully dilated and the red reflex is visible, the surgeon can insert the cystome into the eye and begin using the sharp point to gently tear the capsular bag. If the surgeon has forgotten to use forceps to keep the eye stable during surgery, the eye will roll with the force of the cystome, and cutting the capsular bag will be difficult, dangerous, and is not recommended. With the forceps positioned correctly, the surgeon can slowly cut the film of the capsular bag in circular sweeping motions until the film is finally separated and can be moved freely, ready for removal. The capsular bag is a very delicate, fine structure, which requires a great deal of precision and care to handle properly. This simulation models the interaction in detail, and allows the user to practice this repeatedly in a risk-free environment to ensure that they get it right first time when it comes to operating on a real patient.